I've learned a few theory behind the flaps we do normally and how to do it safely, and consent, how to explain things to patients, and we've got some amazing teachers here, so it's been quite useful.
Because I'm trying to become a GIPSy with special interest, a GP with a special interest in skin cancer over in New Zealand, and in our area they've decided that this is the course that they feel offers the best way of accrediting us, and therefore I'm going through the various process of doing all the bits to become an advanced skin cancer certificate.
These two hand studies are very interesting. This is the randomized control trial, over 1,300 patients.
Skin cancer is my passion, so now I'm exclusively work on skin cancer field. So because I'm only do skin cancer job, I decided to just come back and continue more learning through college.